Hey everybody, Connor Boyack here. Wanted to give you a quick rundown of some of the key changes between Proposition 2, the Utah Medical Cannabis Act, and this new agreement that you heard about last week in the press conference up at the Utah Capitol. There's been a lot of questions, a little bit of confusion, and so we want to set the record straight and help you guys get up to speed on what's changed. Now, I'm not going to talk about what is in the entire thing, because a lot of it is the same as under Proposition 2, and the public's had well over a year to understand what's in there. You probably are very well versed in what's in there. I'm instead going to talk about the key changes between Proposition 2 and the new agreement. So I've got my list here that I'll be consulting just to make sure that I've got everything. But this is a quick rundown. Feel free to share the video with others who you know are patients or supporters who want to understand what this means, why it's happening. When I get through this list, I'll talk briefly about some of the strategy and why we decided to do this, why Libertas Institute specifically, I'll just speak for us, who's been at the helm of this issue for 5 years, decided to go this new sudden path. So I'll talk about that at the very end, but let's get through some of the key changes. The first big one I want to talk about is the changed condition list. So largely it's the same. The opposition wanted to take a whole lot of conditions off there that we were able to defend against. One of the changes is we've lost, quote, other autoimmune disorders, but HIV is still there, MS is there. Where we have specific conditions listed, those were protected and kept, but the broad, other autoimmune disorders is not there. So too with the gastrointestinal disorders. Crohn's disease is still covered, so is ulcerative colitis, but this catch-all provision is not there. However, if those provisions we lost, if you have an other autoimmune disorder, but there's a lot of pain that you have, and conventional medication isn't really substantially resolving it, you would qualify under the pain provision, which is actually a little bit better. It doesn't require you to first use opioids, and so it's going to help a lot more people. We've added terminal illness as an approved condition if you have less than 6 months to live, since the legislature had already signed off on that policy. We've also added hospice if you're under hospice care as a provision. And so I think those are great additions that all in all, I think it's actually a net positive for how things ended up. The next thing I'll talk about is dispensaries. So under Prop 2, there were going to be about 12 to 15 dispensaries around the state. There are many in the legislature who don't like dispensaries and didn't want them to exist at all, and should Prop 2 have passed, they wanted to undermine that and change it. So there's this different concept called the State Central Fill Medical Cannabis Pharmacy, and that's going to be a government-owned dispensary, if you will, that will ship your medicine out to a local county health department where you can pick it up. Now, this is only one path. There are two paths. The other one is the traditional dispensary, although now it's called a medical cannabis pharmacy, even though it's not an actual traditional pharmacy. And those are privately owned, and there's going to be between 5 and 10 of those in Utah. A pharmacist has to work there so that you can consult with them as needed, but these are privately owned facilities, and they're going to be scattered throughout the state for geographic dispersion. Minors aren't going to be allowed inside. You will have to present your photo ID, your government ID. Patient records will no longer be destroyed. That was a provision we ended in towards the end of developing what became Prop 2. So now the records will no longer be destroyed. And if the state central fill government-owned system doesn't get up and running, we have some trigger points, some dates by which more licenses are going to be given for the privately owned medical cannabis pharmacies or dispensaries to make sure that patients get the medicine they need. So those are the key changes to the dispensing model of how you're actually going to get the cannabis. The next provision I'll talk about is medicine type. What does this cannabis actually look like? Basically, everything is still on the table. There's just a little bit more restrictions around it because the opposition wanted to get rid of the flower, the bud, completely. They wanted to get rid of edibles completely. They wanted to get rid of resin and wax completely. But we've kept them with some tweaks that I'll talk about. Most of the methods aren't changing. Oil isn't changing. Tablets, cream, topical, transdermal, all those things aren't changing. If you want to use flower, though, if you want to use the bud, what changes is the packaging type. It has to be in what's called a blister pack. So if you think of the Eclipse gum, I think sells it this way, or some allergy medication, it's in those foil packets where each individual pod you have to kind of tear open so it's tamper evident and so forth. That's going to help law enforcement distinguish between an illegal bud and a legal bud so that they can enforce against the recreational law and not know which is which. And that's how we protected flour rather than having it gutted completely. So you can buy flour, it's just going to be in these packs that have to have consistent dosing. So let's say a half gram, but half gram, half gram, half gram in each of the little pods. That's what the flour in Utah is going to look like. Edibles are preserved. They wanted to eliminate edibles, but there's no cookies and brownies and chocolate drops and gummy worms. Instead, the allowable form of edibles is in cube shape. And that can either be a chewable, like a gummy, or dissolvable, like a lozenge, if you want to do that instead. It just has to be shaped like a cube. The other is resin and wax. They wanted to get rid of that. The way we saved it is as a tertiary delivery method. And by that I mean you have to try 2 other methods and fail, or that they don't work, or you don't really like them. And after 2 other methods, then you'd be eligible to try resin or wax as well. The purchase limits remain the same. Every 14 days, 2 ounces of flour or 10 grams THC. However, now there's a maximum possession limit, 30 days. So 4 ounces of flour or 20 grams of THC, that's the maximum possession limit that you can own. Basically a 30-day supply. The next provision is about physicians. So who can prescribe or recommend or give you the card? Only MDs or DOs. So not nurses, not physician's assistants, only MDs and DOs can provide the recommendation. They have to take 4 hours of training every 2 years to help them understand what's in this law, best practices about cannabis and so forth. Physicians can optionally, in addition to saying, for example, Connor, I think you'll benefit from cannabis, so here's your card. Physicians, if they want to, can optionally specify a dose. They can say, I think you ought to take a 5 milligram oil, 4 drops a day for 2 weeks. If they even know about dosing, which a lot of physicians don't, and if they want to put their DEA license at risk, because physicians can't prescribe, they can't dose. So it's optional. Now, if they don't specify dosing, when you get your card, you have to go to the medical cannabis pharmacy, and you're required then, under this path, to consult with the physician who works there. And together you're going to figure out what that dosing is going to be. So it's not a free-for-all shopping experience. It's talking to the pharmacist to say, well, let's start you on this, try it for a few days, come back, and then we can tweak it if needed. You can buy more, double the dosage, try a different delivery method, something like that. And this is a simple, silly one, but physicians can't receive any kickback compensation from like a affiliate system or referrals. They can't get that as well. The cards have also been limited. Now, keep in mind, for many new drugs, a physician is probably only going to give a prescription for like a week or 2 weeks. It's going to be short. You're going to come back to the doctor and talk about how it's working. And so the card length under this agreement has been limited. So rather than 6 months right off the bat, your first card can be up to 1 month maximum. The second renewal can be up to 2 months. And then thereafter, you can go to 6 months. So this is going to have the patient get back to the doctor a little bit, talk about the dosing, talk about how it's working, and figure out if they want to prolong it from there. The triggers are a little bit different. So the affirmative defense, right when this becomes law in December, patients are going to be able to legally use medical cannabis. They won't be able to get it in Utah because the dispensaries will take a couple years to get up and running. But you can get it from out of state as long as it's in one of those approved formats. So if you want flour, it's got to be in a blister pack. And we anticipate that the dispensaries around the borders of Utah in neighboring states are going to start catering to Utah's market by producing flour in a blister pack. But you can have oil, you can have edible cubes, these exist, right? You can have those and be protected starting in December when this is enacted. You, however, have to have had a previous diagnosis and evidence of it from a physician for one of the approved conditions, and your physician, before you were ever arrested, should you be arrested for possessing cannabis, physician before that time had to have believed that you could benefit from using cannabis. So if you have a doctor's note, you'd be covered, or if the physician would ever want to go testify on your behalf and say, well, no, yeah, we had a visit, a month beforehand, and I said he would benefit, those things would be covered. And should you ever be prosecuted, you have what's called an affirmative defense. So in court, you'd be able to explain to the judge that you're a patient, you have a diagnosis, and you'd be covered, and they wouldn't be able to convict you. That affirmative defense is going to last until January 1st, 2021. Why? Because that is the date when dispensaries or the medical cannabis pharmacies have to be operating. And after that time, the trigger changes. So no longer is it that affirmative defense that will be for a couple years. After then, the trigger is that it will be straight medical decriminalization if none of these medical cannabis pharmacies are operational. So if the government slow rolls this, or for whatever reason, if they're not operational, not only do physicians get protected in court during prosecution, they simply can't even be prosecuted. So once a prosecutor realizes that you have a card by that time or whatever, you can't even be prosecuted at all. So no more home grow or personal grow or whatever it was called before. I think this is actually better because few patients were actually going to want to go to the trouble of growing their own plants and processing them. Instead, they can still get the products from another state and simply not be prosecuted at all. And then for that central fill, if that government-owned database doesn't get up and running, there are some timeline penalties in there that are going to allow for more licenses to be given to the private retail medical cannabis pharmacies so we can get up to 10. A few final options that I want to go over before getting into the strategy. Now, patients are only prohibited now from getting a card if they had a felony for drug distribution rather than any felony, so that's improved. There's a new crime created for diversion, so if I'm a patient and I have product but I'm sharing it with my friend to use recreationally, for example, that would be against the law. Smoking is still against the law, and the existing marijuana possession criminal penalties would apply if you are smoking because you're violating the law. The liquid assets required to open a business, let's say you want to own a medical cannabis pharmacy or one of the grows, all of which will be privately licensed, not government run at all. The liquid assets that you have to have in order to apply are now cut in half. That's a good thing. Zoning is changed. So rather than the 300, 600 feet thing, now cities are being told that for the medical cannabis pharmacies, they have to zone them the same way they zone a tobacco shop or a liquor store. So if there's a commercial zone in their city where those can operate, so too can the medical cannabis pharmacy. Few final options. All cannabis products have to carry a warning label, which is reasonable enough. Employers now can't discriminate against you just for having a card and for being a patient. So in addition to the landlord protection, that's an employer protection. Finally, detailed reporting is going to be made available on an annual basis so that us, you, legislators are going to be able to fully understand the system. How many patients are there? What are the different conditions? What type of products are there? What's the contrast in the market between the private medical cannabis pharmacies and the government-run one? How is that even working, et cetera? We're going to have a full breakdown of the data to make sure we can bird dog this and understand what's happening. Now the question is, why even do this at all? Why compromise, Prop 2, we're going to be able to vote for it. The important thing to understand is that this is a long-term game. We've always wanted to make sure that we have long-term success, not a single vote, not win a battle and lose the war. We need to be thinking about the long-term for patients. And if we passed Prop 2, we would have been through years of protracted battles with our opponents who would be very prepared, legislators, to undermine what was done and cut it down to, say, 50% of what voters enacted. And we were not willing to take that risk. We're not willing currently to take that risk. We need a long-term program for you, for the benefit of patients. And so we entered into negotiations to see is there even opportunity for conversation. And after 40 hours of meetings, what we found in the end was that there were at least enough shared principles to get us to the point where rather than our opponents taking a sledgehammer to Prop 2 and removing flour, removing edibles, removing all these conditions, we could give them a scalpel and we could say, well, why do you want to remove that? What's your specific concern? Let's narrowly restrict or regulate that, but preserve it for everybody else. And the fact that we were at the table and able to give that input and accomplish that resulted in an agreement that is 85–90% of what we get in Prop 2, but it protects it for the long term because we now have brought the opposition to the table, and all of the strong opponents and all the government officials who didn't like Prop 2 are now supporting this instead. So it's strategically beneficial for the long term. We don't love everything in the bill. There's some silly stuff, but it's enough to allow this to move forward without opposition. Let's give it a few years to see how this is working, identify some of the problems, come together, everyone around the table, and figure out and problem solve how to do it. We think this is the right thing for patients. It's the right thing to get it done over the long term. We hope you agree. If you have any questions about this that we haven't answered, feel free to shoot us a message on Facebook or on our website, libertasutah.org. Be sure and share this video with your friends. This is the hottest political issue in the state this year. There's a lot of questions about this. Hopefully this video has answered some of yours, so be sure and share it with your friends, and feel free to reach out in the meantime if you have any questions. Thanks, everybody.